Fighting COVID-19 can be a lonely business. It can also be scary. Investigative journalist Khadija Patel has written about her experience on the Bhekisisa website. She joins us now with more on her moving story. Khadija, good afternoon to you. Thanks so much for your time. I mean, at one stage, it's an incredible story. You had 12 family members with COVID. 4 were in hospital. 2 were on ventilators. How did this happen?
Yeah, I wish I knew myself. We can't exactly pinpoint when we were all infected, but we are reasonably sure that the point of infection was from 2 of my cousins who work at school. And once schools reopened, one of them worked as an occupational therapist at a school, and the other one is a high school English teacher. And so we were getting childcare duties. Their kids, would be dropped off at our house. And on top of that, my dad's office is at home. My aunt works for my dad, so she would be in and out here. And in that way, 12 people in one family were infected.
It's incredible. I mean, you yourself actually tested positive for COVID. I mean, in your article on Bhekisisa, you actually talk about being stigmatized by a doctor.
Yeah, it's a strange thing. So I recovered from COVID, and then I needed emergency surgery for an autoimmune condition related to an autoimmune disease that I had. And while in the hospital, what we have to understand is that hospitals are not, they're in horrible places as we know them usually, but they're particularly difficult spaces right now because hospital management has taken such severe steps to try to curb the risk of infection for their staff. So I was put in a ward called the PUI ward, which is Persons Under Investigation. And while being wheeled to the theater, another doctor, took umbrage with the staff that were actually wheeling me down, and in the manner in which she addressed this doctor and nurse that were wheeling me, scolding them for a litany of offenses that that she said that they'd committed. For example, bringing my file out and then saying that it's now contaminated, and and going on and on, and as a patient you're just sitting there, and it's the most harrowing experience because it's almost as if you are subhuman. In that moment, as I say in the piece, that I really felt like the most objectionable thing there was my presence. And that's very, very difficult to deal with, especially for patients who are already so afraid, nervous, and have no family support because hospitals are not allowing any visitors. So it is an especially difficult time, and I can't say I blame that doctor either. I understand what she was trying to do. They're trying to protect each other. They're trying to ensure that the hospital does not get shut down. And and I have to have empathy for that. But at the same time, as a patient, there's a sense of you being almost subhuman in this process. And that really extended to our experience as well. With my mum being in hospital, my mum was severely ill. And the process of having to actually access her, the doctors and nurses caring for her while she was ventilated, it really does speak to a lack of communication, I think, but also a lack of compassion. And I'm talking about an experience in the private sector. I can only imagine what it must be like in the public sector where health workers are that much more overwhelmed. So yeah, I think that my own experience, accessing medical care during this time, has alerted me to the fact that even in hospitals, there is a danger of us losing compassion for patients with COVID-19.
I mean, Khadija, it's such a difficult situation and that you describe. I mean, just to get updates on, the condition of your mother, for example. I mean, she's on a ventilator in the ICU, desperate. I mean, minute by minute you want to know how she is. You can't be there. How difficult was it just to find out how she was doing?
So it was especially difficult because she was of course on a ventilator. She just obviously sedated, so she does not have access to her mobile phone. And so, we would begin every day by calling the hospital. We call the reception and then ask for her unit. And that, basically was the game we would play nearly every day. On many occasions, the call would go unanswered. On some occasions, a nurse would answer and would be very, very pleasant and very ready to answer any questions we may have. On some days, we would want to know, how is she? Is she on her back? Is she on her side? Those are the kind of mundane questions that, that trouble you deep in the night when you don't know what's going on. And often those nurses would be ready to share that information. Other times nurses would be irritated with us and tell us, go ask the doctor, why are you asking me? And the thing is that because my mum, was admitted through the casualty, it's not like we had personal contact with the doctors treating her. So my sister basically started calling all the doctors at the hospital where my mum was at. And one receptionist at one of the doctor's surgeries shared mum's doctor's number with us. And that's basically how we, established with her. We then, would exchange WhatsApp messages with her at least once a day. And that's how she would keep us updated on mum's condition.
Sure. What a story. Khadija Patel, thank you for your time. Good to see you up and about and actually able to speak to us again. And strength to you and your family. Thank you. Khadija Patel, the investigative journalist there.